Well, good afternoon, everyone, and welcome to the public board meeting of the Care Quality Commission. It's 2 o'clock on the 27th of November, for those of you watching it on repeat. I deal with some administrative matters first, and then we'll go into a quite full agenda. I only have one apology, who's Stephen Marston, one of our non-executives. He was able to join us this morning, but is in another part of the country and unable to join us this afternoon. But otherwise, we have a full board attendance. Welcome two people. Howard Missouri, a clinical fellow, is here to observe us. Welcome, Howard. And Amy Robson, they represent the LGBT plus network, and was with us this morning as well, and indeed gave some helpful observations. Are there any conflicts of interest? There are one or two declared earlier on today, which we have noted. It was done outside the meeting. So I won't ask people to repeat those. Are there any others that people want to note? Okay, thank you. I should clarify, I say conflicts of interest. Nothing was a conflict, but there were interests that we noted, but nothing that would represent a conflict. We have a fairly full agenda, but is there anything people wish to add to it? No? Okay. I would just note for anyone listening in that we have got a slight change to agenda item 4.1. The paper, in truth, probably wasn't quite ready to come to this board, so we have withdrawn it, but we've replaced it with a paper that we didn't have time to discuss in another meeting, also in another aspect of Ofsted. If any of you are looking for the papers on the website, they should already have been changed over. Apologies for any inconvenience, but we will still have a slight 10-minute session. There is, though, one point in the papers that we've withdrawn that I would like to make sure we pick up, so I'm going to ask James or Chris to talk to that later on. The couple of further points from me. I thought it would be appropriate and helpful just to remind everybody and put on record a number of board changes that have happened or about to happen or will be happening at some stage next year. So, and there are potentially quite a number. So on the executive side, Julian is joining us on Monday, but there's a formality to deal with later on, which I will deal with. But delighted that Julian will be joining us, and he'll become a board member as the chief executive. Since we last met, Tyson, who remains with the organisation, a slightly different role, but has now resigned as a board director. As mentioned in a few moments, we are hoping at some stage to recruit some new chief inspectors, and under the framework agreement we operate with the Department of Health and Social Care, we would expect to appoint them to the board. Since we haven't started the campaign yet, we don't know who there will be, but we will probably appoint them to the board as quickly as we can. So that it's possible there'll be further changes for our next board meeting, which we'll need to ratify, but I'm not entirely sure about that. On the non-executive side, since the last meeting, we have lost Ali Hassan. Ali had a full-time job at another organisation, but also found time to be a non-executive director with us. He's changed executive jobs, and unfortunately his new employer does represent a conflict with the interests of CQC. It's basically associated with a body that we regulate, and therefore Ali had to stand down at 31st of October. A sad loss, but we have thanked him for his contribution over several years. And then Belinda Black is standing down at the 31st of January, so still 2 months away, and many meetings between now and then that she will be participating in. But the timing of our board meetings are such that the January meeting is actually in the first couple of days of February. So it does mean that although it's still quite some time away, that this will in fact be Belinda's last full board meeting. So Belinda would like to put on record our thanks for everything you've done over the last few years. You are our Mental Health Act nominated expert as well, so there's a specific issue role to fulfil. as well as just your common sense and other wider contributions. So we're, from the point of view of the board, we're certainly not saying goodbye to Belinda yet. There's another 2 months, but I should recognise the fact that by the time of the next board, you will have stood down. I suppose a final point I should mention is it's much further into the future, but I should say a word about my own position. I, like all NEDs, was appointed on a fixed-term contract, so my contract expires on the 31st of March next year. I indicated to the department a little while ago that for predominantly personal reasons, I don't wish to be considered for reappointment to this role. It's been a very difficult decision. This is a tremendous organisation, but as I say, largely for personal reasons, I don't have the capacity to take on another 3 years after next March. I have indicated that I'm really quite flexible on timing, so should my successor not be identified by then, I'm more than willing to stay on. So I don't actually know the date at which I will be departing yet. As I say, that is potentially many months away, but I just thought, mentioning all the other changes, it would be appropriate to say that as well. Then we, as you know, we have private board meetings as well as public board meetings. We had a private board meeting this morning, and as I'm sure listeners expect, we spent a considerable amount of time, roughly half the meeting, on aspects of our recovery. And as I did last time, I thought it would be helpful just to pick up a few high spots for those that weren't there and are listening to this. So let me give what I would summary of what I thought are the main points, and if any of my colleagues feel I've missed something important, I'll ask them to add in. There are really two parts to it, a discussion with Vic Rayner and then a discussion of the presentation from the executive team. Vic Rayner, for those that don't know, has been leading a piece of work looking at the impact of the single assessment framework on the adult social care sector, and that is complementing the work of Mike Richards, who has already done some work, and indeed there's a report, an interim report that he provided that we've already published. So Vic is very much a work in progress, and she's doing work both for herself and working with Mike. So, but we wanted, given the importance of this work, to have an interim update from Vic on what she's finding so far. She has done a survey involving quite a large number of participants in the adult social care sector, and a lot of what she said is basically playing back to us what she found on that survey. I suppose at a high level, I would say there was nothing we heard that was a major surprise, and that was the view of those of the executive. And by that I mean none of the topics raised are things we haven't heard before, but in summary I would say that the strength of feeling, particularly bearing in mind the number of participants, was very clear from that, and something you don't pick up when you just discuss something with one individual provider. When it's all pulled together, it comes through very much more clearly, as well as some additional insights, obviously, in some of the comments. I think there were some question marks over the co-production work that we have done. I mean, we have, as an organisation, tried very hard to co-produce things, but one of the messages from Vic's work is that the nature of the adult social care sector, with such a large spread of scale of organisations, from really quite small organisations to multinational groups, means that what is appropriate for working with one group may not read across to another. So I think there's lessons to learn from us there when we are working with groups and co-producing, that we recognise the differences in some way, shape or form. An overarching theme, of course, that we recognise the fact we need to rebuild trust. I mean, that's obvious, but it does also impact the method of communication in the short term. There is a risk that things we say, which are meant for the best of purposes, could be regarded with some scepticism, and therefore I think we need to be doubly careful in the way that we communicate. We had some discussion, and I think we need to do some more work to understand how much of when the findings are given about issues of working with us, how much of that is a consequence of the newer ways of working, in particular the single assessment framework, and how much is a historical issue. I mean, it's still an issue to be dealt with, but the solutions are different. Obviously, if you change SAF and that's not the core problem, you're still left with some issues. So the delta, as someone said, for the SAF regime, I think is important to understand, and we've asked Vic and the management team to think more about that. Proportionality came up from providers. Not surprising. I think it's an issue for every regulator, and what the regulator thinks is important, particularly if we are having to do certain things in accordance with legislation, doesn't always accord with the views of the executives who run organisations. So we recognise, we're not being complacent, we recognise the need to address it, but being realistic, there's probably always some tension there. The other dimension I think that we have to take account of is the views of users. And I did say this morning, and I'll repeat it, but if I look at the correspondence that comes to my desk, it's notable and entirely understandable that the view of somebody who runs a care home with a large number of people about the impact of one incident could well be different from a close relative of the person who suffered the incident. And that's an additional complexity we need to deal with. So I think potentially quite a lot of actions come out of that. Some are already underway, and Vic recognised that some of the points that have been identified are already being addressed by the actions we're undertaking. But there are other things we need to think more about and take account of some of the points that we discussed that I mentioned a moment ago. And it will be, we do need to give, this is work in progress for her. She's still doing more work, but at some stage we will have to compile what she's told us, look at what Mike Richards has told us, and then be transparent and communicate to people what we've heard, and more relevant for people what we're doing about it. And I think that's an important prerequisite to building trust. So that was the discussion with Vic, and we're very grateful for Vic and indeed all the people she works with for what she's presented to us. The other thing was then quite a long discussion with the around the recovery generally and how that's going based on presentations from management. As most people listening, I'm sure, are aware, I mean, we are still challenged, is a simple way of putting it. We aren't seeing the progress that we would like in a number of areas, but what I would say, and I think it's important for people to understand, I think the transparency of that to the board has changed significantly over the last few months. One of the consequences of that is that we recognise that people, and I think in particularly of our own staff here, but it probably applies to providers as well, are not seeing the benefit improvements and what it means for them as individuals. I'm not going to say too much more about that because I think James will probably touch on it in his Chief Executive update in a few minutes' time. One of the ways we need to deal with that, I mean, whether or not people see improvement as a combination of substance is an improvement, but also do they understand the changes that have been made and what should be happening. And I think we recognise there's a need to improve communications. Internally, one of the changes we're looking at or using indeed is to make better use of the existing line management channels. So instead of a communication from the ET level through a very large number of people, which is quite difficult to do, but using the existing line management channels, that potentially is slower, but I think it's more useful because that way people hear it directly from their line boss, and if necessary, there can be discussion and whether or not these changes are the right ones. It does also mean, though, that we're able to make more use of input from people in CQC. And there are some examples of whereby being able to better engage with people on the front line, we get useful input to things that could be done differently. And probably as an example of that, I would cite one of the pilots is now effectively a hybrid pilot, and the way that's been put together does reflect the input we've had from some of our staff. So I would like to thank those involved, specifically in this case, but just to offer a word of encouragement to others. If there are things you see aren't working, please do raise them and we will seek to address them. I hope a message that's come through to people is the ability and appetite, or is it the other way around, of the organisation to respond to feedback from our staff has changed. All of that said, I think there is a challenge for the executive team that we are very sensitive to here, that there has been in the past promises for things to be different when they're not, and nobody wants to overpromise and underdeliver. In many ways it is much better to underpromise and overdeliver, But if you under-promise too much, it means you're not telling people the things that are happening and what might impact them. And it may well be in certain cases, with the knee-jerk reaction to not over-promising means that we're unnecessarily under-promising, which is a difficult balance to achieve. We recognise that, and it has to be looked at. We talked quite a bit about the priorities for the organisation. There was a board away day about a month ago where we looked at this in a lot more detail and made sure around the board table and the executive team that we are aligned on what the real priorities for the organisation are. Given the challenges ahead of us, we have to recognise the fact that not everything can be done at once, so we have to be clear what the priorities are, and there may be a need or an opportunity to be more transparent about that as well to people in the organisation. Amy was with us this morning, and it's always helpful, increasingly helpful, I found, to have chairs of networks there, so I was able to make some useful observations, but in particular suggesting we could make more use of the networks in some of these areas. So thank you for that, Amy. And then finally, something we spent quite a bit of time on is the backlogs that we have in a number of areas. Won't list them all, but things like information of concern. This has been one of the biggest concerns for the board or the non-executive members of the board. We had really a much more insightful analysis both of what the problems are, understanding the problems, and what it is that we are doing to fix them than we have had before. I won't go through everything that came out of that, but I'll highlight just one or 2 points. Firstly, as we clear the backlogs, we're very keen to make sure that we understand the learnings from that. And by understanding the learnings, I don't just mean a technical, here's a learning, but getting it back in the hands of frontline users as quickly as we can. In other words, to say if we did something differently, these backlogs might not occur in quite the same way. We do recognise there's a big impact of our systems and technology here, and some changes can't be made probably till we fix the technology, but there may be workarounds that are being looked at, we know. And the second point I'd make is we have to recognise the fact that it is a fact of life that there will always be an element of backlog because of a timing difference between the data which something is received and we're able to look at it and decide what should be done about it. It needs to be looked at. So I suppose you could argue that's not really a backlog. At what stage something that is a natural timing difference becomes a backlog is a point of debate. But we're trying to get a better understanding of what the total numbers mean in relation to those to analyses. If something has been around for too long, that's clearly a real concern, and that has to be addressed, and the management have initiated a number of steps to try to get through the backlog, and we saw some quite useful information about things going into the hopper and things speed it coming out to the hopper, but more needs to be done there. But contrast that with what historically has been a fairly steady or often a steady level of items that haven't been processed or dealt with. I mean, that is demand-led. I mean, our resources are finite, and demand or the number of notifications or whatever coming in does vary, so you've got to accept some fluctuation. But I think as part of next year's more fundamental business planning, we have asked that we look at what historically has been the level of timing difference or backlog, whatever you want to call it, and see whether or not that can be reduced to be more effective, and in particular whether we can make better use of technology. So I said a summary, but you gather there's quite a lot we discussed this morning, and that is only some high spots, but it was a good discussion. We would thank the management for the openness with which things were presented. I'll just quickly ask my non-executive colleagues, or indeed anyone around the board, whether or not there was anything major you felt I didn't cover there. No? Okay, well, look, thank you very much, everyone, for listening, and I hope it was helpful to understand the time and effort that the board put into looking at these things. Let's move on to the more normal business, and me covering those two areas does mean we're slightly behind schedule, but we'll try to make up. James and Chris, we have a report from you on organisation regulatory insights. We will take the papers as read, but there are a few points you might want to highlight, and then we'll go to questions. Thank you.
Thank you, Ian. I wanted to begin by echoing your point about the amount of work colleagues are doing to work on the recovery and the improvement within CQC, and to echo your thanks to the providers that are working with us on a revised way of working from Monday, the 2nd of December, we are rolling out our hybrid assessment. CQC's recovery covers all aspects of our work, including how we deal with registrations, as you described, the backlogs, and also includes how we've structured our teams and the expertise within them. But we particularly recognise that on our assessment performance, we do need to radically improve that for the remainder of this year and into next year. So from Monday, we will be rolling out our hybrid approach to assessment, which includes a reduced number of steps, and we'll put this information in the public domain. And for those providers who have been assessed using our current arrangements, that will continue, as it were, for them in the normal way. We won't mix and match these two approaches, so we keep consistency and fairness in relation to that. And we hope to be reporting to the board come February the impact of that change in terms of the numbers of assessments that we are able to carry out across social care and health. So look for more information on our own staff on our internal homepages, but for external colleagues on our website, which we'll be updating shortly to contain that information. On the Chief Executive's report, I just want to highlight just a few matters. First of all, wanted to note the continued work of our local authority assessment teams. We're now into 75 councils. We've published 13 reports, and the rate of publications and work, as it were, will go up as we enter towards the end of the first year. I've got the opportunity this week of attending in Liverpool the National Conference of the Directors of Adult and Children's Social Care to have a further conversation with them about their experience, but wanted to place on record my thanks to them, to the LGA and to ADAS in working with us on improving that process of assurance and assessments, which is growing in confidence internally within our own staff and their expertise, and externally in the reports that we publish. It's not without its challenges, of course, but that partnership and the collaborative way we've approached that has been an essential part of rolling that out. Secondly, I wanted to note that every year CQC, we're very cognizant of the impact of winter across health and across social care. This year, as people will see in the report, we are featuring some work looking at emergency care pathways and carrying out inspections to make sure that, as health services quite rightly focus on the as it were, sorry to use the language, the throughput of people through hospitals into the community, we make sure that the quality of people's experience and the standards that are applied in those situations are good. And so we're looking at particular systems under pressure over the winter to look at that work. And thirdly, I wanted to bring the board up to speed with the independent care and treatment reviews that we're undertaking on behalf of NHS England and nationally. A small number of people, 93 people in the cohort here, but really high levels of support required for those individuals and their families. And we've been able to undertake 21 panel reviews of those with a further 36 scheduled. So we're well underway. We're meeting the target set by us for that piece of work. And I'd expect to be able to come to the board and for CQC to report on the impact of that on people's quality of life. And we'll have seen from the media some of the very difficult circumstances that you can find with people with very high levels of learning disability or autism need, and the difficulty that people have in providing support in those situations, but the absolute necessity of taking a person-centred and safety-first and safeguarded approach to that. So I wanted to draw attention to that good work that CQC is underway with. I will take the rest of the report as read, but some of my colleagues, executive colleagues, might wish to comment on either the well-being work that's underway within the organisation around supporting our people, and in particular the large degree of engagement work that we're now doing with it's not new anymore, is it? The new government, with the government and its agenda for health care and communities, and particularly mental health, where my colleague Chris Ziti is taking the lead for us in responding to the potential for the mental health changes coming on track.
Chris, do you want to add anything on mental health? And then Jackie, if there is anything on well-being, but equally we have a session on people later on, so you may wish to pick it up then.
No, thanks, Ian, and thanks, James. Yeah, just a few things to add on the Mental Health Act. So the government introduced the Mental Health Act Reform Bill on the 6th of November. And the aim of that really is to improve the Mental Health Act, thinking about addressing key concerns around detention, individual rights for people, care and treatment, safeguards, and some issues around racial disparities on the use of the Mental Health Act. There are some implications for us as CQC in terms of an increase in our SOAD work. That's the second opinion approved doctors who review people's treatment in mental health services mainly, and other services where people are given medication. It also increased our work around operational activity on complaints, and also thinking about people who are deprived of their liberty under supervised discharge in hospital. The other area I just wanted to raise as well is around, we've written to the minister to highlight some concerns around the delays on deprivation of liberty safeguards, which is supposed to be replaced by the liberty protection safeguards. There has been a delay on liberty protection safeguards being introduced. One final thing I would just want everyone to note is that the work we do with the National Preventive Mechanism, because we don't normally talk about it a lot actually, but it's a really important role we play with the other 3 nations in the UK, which is about looking at people who are detained in services and their experience and whether they're being kept safe or not. We've got an annual report which is being published in December. They focused on some of the work we've done in CQC in terms of thinking about the Section 48 work we've done, the work we've done on restrictive practice, and also the work we've done on patient and carer rights equality framework. So those are some of the areas I suppose I wanted to highlight this afternoon, because they impact on people's experiences of services in mental health services.
Okay, thanks, Chris. Jackie, do you want to comment now or later?
Yeah, I'll come in now for a couple of seconds, if that's okay. So I think from a wellbeing perspective, we have had quite a few interventions in terms of best practice, taking breaks, talking to colleagues, talking to line managers about how colleagues are feeling, the challenges that they're facing, working with health and safety in terms of the risk assessments with the usage of the new system and how we can best support colleagues who are experiencing discomfort with using the system. But I think if we're truly honest, the bottom line of how we can impact wellbeing is how transparent we are with the recovery plan, giving colleagues the opportunity to contribute to that, understand the direction, and also understand that we know what the priorities are. And I think there's still work to be done on that. And I think that will be a massive impact on wellbeing. And we can't, overlook that as part of our recovery plans. I think we can do lots of things to support, but I think they're around the periphery. I think the root cause is in the recovery plan and delivery and priorities of that.
Thanks, Jackie. So, any questions from my colleagues or comments on what's been said? Charmaine?
I just had one on wellbeing, if I can. Obviously, it's quite a difficult conversation for a manager to strike up with colleagues working with them. Can we talk a little bit about what we've done to support our managers and what kind of toolkits we've given them to enable those conversations? So we've talked in the past about HSE have a toolkit. There are things that can be built into conversations that are not always easy to have, and also about how we're helping them identify risk of significant stress, please.
So on our intranet we've got a dedicated wellbeing resource, and that has got a wealth of information there. And also in my team we have got a dedicated deputy director who is leading on wellbeing. So we'll regularly working with the wellbeing coordinators, put up some, new way of thinking, best practice from her experience, be available to talk to colleagues, and also in terms of from an executive team and my team, how we share that information so we can identify colleagues who may be at risk, who may be needing intervention, because you're right, it is a difficult conversation. And what makes it even more difficult is the homeworking element, because you can't see body language, you can't see people in front of you. So it is about how we recognise when we hear something, we don't ignore it, we follow up on it. So, that's where we are. Is it a perfect fit? It probably isn't at the minute in terms of trying to understand what else we can do. But I honestly believe that we're trying to cover every base, from a homeworking perspective to making resources available, providing support and being vigilant, all of us.
Any other comments from people? Okay, well, look, thank you very much, James, Chris, and others. Probably best if we just move on. We have a paper now on, James, I think probably you leading as well, along with Joyce, on the response to the Penny Dash report and the report that we commissioned from Mike Richards. Quite a lot of this is already out there and in the public domain, but I think it would be helpful just now to be quite clear on, for the board to be clear and approve the responses that we have already made and we are proposing to make those pieces of work. So shall I hand over to you?
Yes, just to confirm, Chairman, given the timings of publications of reports, we were very, I think, clear and in the public domain about what our response was, and so we've put that out there. But we feel it important that, formally speaking, as it were, the board gets an opportunity to, as it were, endorse our formal response. And I think, Joyce, you have led for us in bringing Mike Richards and Vic Rayner's work together. So I'll hand to you. Thank you.
Thanks very much, James. I'm just going to go briefly through the key changes that we want to make, and this is really for the board to note our approval on both reports. So in October this year, we received and welcomed 2 independent reports on the effectiveness of our regulation, and that was the Penny Dash review, which looked at our operational effectiveness, and the report by Professor Sir Mike Richards, which looked at our assessment framework. So the Dash review covered several recommendations which are outlined in the paper around how we must improve our performance and sector expertise, as well as our assessment framework. There were 3 further areas which were not in the interim report but are in this final report, which is about our local authority assessments and the ongoing improvements that we can do there. There is a pause to our ICS assessment work, and we will continue to discuss that with the department as to how that would look and what it might look like in terms of our assessment, particularly considering the DARSI review and the NHS 10-year plan. And then there was a final recommendation about improving our sponsorship arrangements, accountability and efficiency with the department as well, who are the sponsors of our independent regulation. The Richards review, we also highlighted at the same time. There were 30 recommendations, and at the time we had 4 high-level recommendations that we agreed, which were about sector expertise with chief inspectors, modifying the assessment framework, improving the systems and the tools that our colleagues use, and improving the provider experience of registration. We agreed those high-level recommendations at the time, and this paper really is about formally noting in the board what we are doing in terms of the 30 recommendations that are in Sir Professor Mike Richards' report. I'll say here that we are in broad agreement with that review. There are some recommendations which we need to consider further. Because they involve others, they're not decisions that we solely take and agree as a management action. We have to do involving others in a decision, but also they're not all within our gift, so we have to do in collaboration with others. You are absolutely right, Chair, that we have spelt out some of the key changes from both of the reviews, but I suppose it's important just to outline here, and I'll do so briefly and then take any questions. So we are in the process and campaigning to recruit chief inspectors. We've talked about 3 and looking to further possibly recruit 4 as well. The integration and the importance of sector expertise we completely acknowledge, and that would mean looking at our reg leadership functions and our operational functions and how they might further integrate, bringing that sector expertise, but also relationships with providers in a place that's really important to underpin regulation. We know we have to model and recruit resources to get the right grades and skills of people into our operational staff, and we know we have to improve the tools in terms of the reg platform and the portal that providers use, which are not the most productive and efficient tools or effective tools at the moment, and we have to improve them if we're going to do our regulation appropriately. And within the report, we know we have to improve pay and the job attraction within the constraints, because we are outside Agenda for Change, but within the constraints within the civil service pay arrangements, we know we'll have to work with the department to look at that as well as understand what it means for us as an organisation. Some of the key changes to the assessment framework are really about working in partnership and co-production with providers and being really transparent about our process. That includes, for example, rating characteristics and producing a regulatory handbook that clearly outlines the processes and the changes that we have made. We recognise that the term single assessment framework is unhelpful. It kind of belies a common approach across all sectors, which was not the intention, but we will remove the term single, not just because it's a word or rebranding change, but because we want to make every effort that our assessment, our regulation focuses on that sector expertise, and we differentiate based on that sector expertise, but still around the consistency of which independent regulation demands. We want to make sure that the processes that we do are clear and transparent in terms of the ratings and how we make those judgments about ratings. There are things, though, we are continuing with, the 5 key questions, the I statements, the we statements, the quality statements, much of which was developed with providers and people using services who've said, this is the standards I would expect from services within those I statements. I also acknowledge that we've said we want to do these things, but we rapidly have to get on and change things. But I think the transparency of that change process is essential, and we need to do that quite immediately. Providers need to know what process we are doing at what time, so to make sure that our regulation is consistent and we're not moving any goalposts or changing any thresholds. So we just need to make that absolutely clear. Professor Sir Mike Richards is working with Vic Rayner, which you alluded to, Chair, just earlier, and we do expect phase 2 of their report, which gives us more information about what good assessment look like, what our approach looks like, so how do we work with providers, and what does the reporting process look like from end to end, from the point at which we might start an assessment process, speak at the end of an assessment or inspection, and then feed back that report and the sort of information we provide to the provider or that area. So that report will give us much more detail on our regulatory priorities and the assessment approach, and we look forward to receiving that report in December. There are lots of other things we will do, but the timescale by which we can do them, we have to be really careful and considered about. So there are some immediate things that we have done in terms of priorities, and you've talked about them, and then the longer term things, which are in both reports, around looking towards innovation, new models of care, influencing the effectiveness of care and use of resources, using far more outcomes data, for example, and being far more robust in our data. We are starting to plan these things, and they will build on the work that I've just outlined in terms of the priorities for us as an organisation.
Okay, thank you, Joyce. So, questions or comments from colleagues? David.
Thank you, Chair. I just had a question, Joyce, if I may, about the term you used, what good looks like, which is what we're looking for. And my question really is, what is the bandwidth across which that review is looking to come up with the proposals about what good looks like? Is it specifically, for example, just to do with health and social care sector, or is it more broad than that?
So currently, Mike Richards and Vic Rayner are looking at the health and social care sector in terms of our regulation. They're doing a lot of engagement with providers. an engagement with our own internal colleagues as well, and then looking at the evidence base in terms of what the future of regulation and what regulation looks like. So it's well informed, but it is around health and social care.
And if I may follow up, do they, within health and social care, as both are delegated in the 4 home nations, are they looking at evidence in the other 3 home nations in that?
Yes, so their review is about us in England, but they are going to learn from the other 3 regulators because they do things that we don't, we do things they don't, and there is that learning that we do. Fine. We also meet with the UK regulators, our chief exec.
Yes, my question was specifically about the review.
Yeah.
Thank you.
While other hands are going up, one comment and then one question. Joyce, the comment is really clarification for something that's in here. It says that we are in the process of appointing at least 3 inspectors. There's been some debate on whether we should have a new inspector for mental health. I think it has been agreed that we should. So, whereas we used to have 3 chief inspectors, we will now have 4. Currently, you only have 1 in the way envisaged in place, which is adult social care, James. But it says we're in the process of recruiting. For anyone out there that says I haven't seen the advert, that's because there isn't one. To be clear, we are ready to go as soon as we can, but we do require approval from the department for some of these things. So we received approval for the Chief Inspector of Mental Health in the last few days. We are still hoping we will get soon the approval for the Chief Inspector of Hospitals. So we are ready to go. We've got the adverts drafted, but we do just need that approval. So for anyone listening who is interested in these jobs, please do look out for that and apply. My question is, you say in here that there's going to be a handbook co-produced with providers, but one of the things we heard this morning, and I picked up in my highlights, is providers do vary enormously, and suggestion that some of the work we've done, including co-production, may have been at the one, for one group that didn't necessarily replicate across. So how does this work you refer to here map to the findings that Vic Rayner presented, that we need to recognise the fact that the spectrum goes from the very small to the very big?
Yeah, and that's really helpful. The handbook cannot go into the specific detail of what good looks like for every single sector. There's about 80, 90 different service types, for example, but what the handbook is going to do is focus on our regulatory approach, which we should do in co-production with providers. So there's a set way of us doing things in terms of regulation, our framework, our approach, how we use data, how we collect evidence, what we do on an inspection, what we do in terms of feedback to providers. So that those are the things that the handbook needs to cover, how we make judgments, for example, and that's really important that we make that transparent and do that with providers. I think there's other things that discuss the characteristics, if you like, of what good looks like. So we want to develop ratings characteristics, we want to develop far more sector and service specific guidance, and that will give far more information. So if you're in a particular service or a care home, for example, or in a dental practice or in a general practice, there will be far more service specific guidance that you could look to and say, oh, that's how they will approach this for me. We have some of that. We need to update it, but we need to do it with providers. We won't do it on our own. And most importantly, I think we need to do all of these things with people using services, because ultimately it's about the expectations of everyone involved in health and social care, not one particular group. And we do want our regulation to work. Our aim is to drive improvement and to work with providers and to work with people to get that improvement in health and care services.
Chris, you wanted to add, and then I'll come to you, Belinda.
Just to add, Joyce is entirely right. Just to add to that, I was lucky enough to be at a co-production event on Monday, which had a range of very small, much larger providers by different sectors. We planned it quite well in advance, so those who were part of smaller groups were able to attend. What was really clear is that all of those, and people use services, that were keen to make sure that we had a model of what we're looking for that everybody understands, so everybody knows the rules by which we're operating our inspection process. And there's a lot of support from small and large providers across the sectors that we regulate to be involved in that. So just to give a reassurance to the board that we're aware of the differences in the different types of providers that we regulate with. We're allowing for different types of engagement, so some face-to-face, some online, some using our portal, to make sure we can capture the views of different people and ultimately present something back that's meaningful to our colleagues, meaningful to providers of different sizes and types, and meaningful to people who use services.
Just ask that, I mean, that's good, but it'd be useful, I think, just to make sure that whether you Vic for the people she represents, since she raised it, and also our own people who are going out how to apply this, that I can understand that the guidance will largely be fairly generic, but actually what that means in practice, it would be helpful to make sure we've got everyone on board as to how that will work in practice. Belinda.
And that's some of that work's already ongoing into, because I've sat in a couple of meetings recently where we've been discussing that with providers about what good looks like. But I just wondered, do we have a rough time frame of when people might expect, you know, something in the hand that they can use?
On the handbook,
Yeah.
I think that we're planning that for, if I say March next year or spring next year, that would be the rough timescale. That being said, Belinda, we want to give people indications of what we're doing and how we're doing it as we go through the transition and the interim approaches that we have. So at that point I made about being transparent about what is the context of our regulation here and now, and how will it change. We will need to update people, but I think it's spring next year. I can't give a definite month, obviously, but yeah, definitely, yeah.
Christine?
Thank you. Just a point of clarification, really. We've been talking about the work that's being led by Vic Rayner, and we've been talking about it as a shorthand, but actually the work she's doing is as part of a collaborative project with the Care Providers Alliance, and I think it's just worth making that point that that's a group which represents the majority of both national and local care providers in the UK, well in England, and also adds even greater credibility to it because it's being done with all of those agencies. So although we're using the shorthand Vic Rayner work, it's actually Care Providers Alliance.
Yeah, I know, to be fair, had she been here, I'm sure she would have made the same clarification, but thank you. Any other questions? Mark?
Apologies. It's bridging the opening chair about there's a lot of activity and there's a requirement obviously to under promise and over deliver. These are 30 commitments, so again it's just seeking the assurance that these are now going to flow fully into the recovery plan, and if there's anything new that's required, it'll go into the recovery plan, and within that we will then start to see clear prioritization of what is going to get work, because it's a lot of additional work for a lot of people, and we need to make sure that it's working in the right direction. So just again, that you're not envisaging that this is opening up work streams that are outside of the recovery plan, apart from the ones that you've already pushed a little bit into the future of we are also planning to do, which will sit into a future business plan.
Yeah, and I'm glad you mentioned that, Mark, because when we looked across Professor Mike Richards' review, many of the recommendations we were already doing as part of our recovery plan, and we are sequencing, because we've got to prioritise, because if we did everything, nothing is a priority. So we are sequencing what's immediate that we need to do to make our regulation safe and stable, and then what needs to be slightly longer term. That drives improvement is equally as important, but we know we can't do just now. So it was helpful that many of the recommendations already in our recovery plan, but then seeded into our longer term plans as well.
Okay, thank you, Joyce. Well, look, if there are no other questions, we are being asked to approve this response. As I said in my opening remarks, and Joyce said, a lot of this we have seen elsewhere, but pulled together like this. Are we happy to approve it? Okay, well, thank you very much indeed, and thanks to the team. I mean, this is there's an awful lot out there that we have to respond to. So thanks for the way this has been pulled together. Okay, let's move on. We have a corporate performance report. Chris, this is down to you. Is Sean joining us? Sorry, I beg your pardon.
Can I just ask one question that's not related to the recommendation approval per se, but is around the timing? So, Penny Dash's report had some 6-month and 12-month timings. I'm just interested in the process by which we're going to sort of keep appraised of the timing, relative to the plan. How we're going to ensure that we are keeping abreast of those timings, James, and how that's going to look.
I think we're going to incorporate that into, I think we're going to have to do two things really. One is to incorporate the timings of the outputs of what we're committed to into the recovery process more broadly. And then the second, I think there are staging posts for the publication of further reports that we would just incorporate into reports back through to the board here.
But if I've understood the point and the answer to be helpful, next time we get the report to have some transparency of what the future plan is for all of these, which I think is what you're getting at, isn't it, Shirley?
Yeah, timing and forecasts, and if we're going to see slippage, knowing earlier than later relative to the recommendations we've just agreed.
And here's your opportunity to make as aggressive as you like, because it'll be Julian's problem for Monday. If we could move on, the corporate performance report. Sean, thank you for joining us. Chris and Sean, as you know, take the papers as read, but highlight any specific issues or concerns or anything that's updated since the papers are put together. I don't often make this point, but it probably is worth saying it now, and I'm flag it elsewhere, that timings of boards means often we have to get papers prepared 2 weeks in advance, and the world's moved on a little bit by the time we meet. So if there's anything that's changed, let us know.
Good afternoon, everybody. Thank you, Chris, and thank you, Chair. This item covers performance reporting in two areas: the Q2 position on the board quarterly report, which covers people's experience, quality of care, safety of care, and health inequalities, and the October balance scorecard, which covers regulatory effectiveness, business processes, finance, and culture and people. In the context of the difficulties we find ourselves in that have given rise to our recovery plans, the board will be well aware that our performance reporting continues to fall behind where we would otherwise expect it to be. You've read the papers, as the Chair has said, and will no doubt have questions for members of the executive team. Before you do, I'd like to highlight 3 areas. Responsiveness in the call centres is improving across registration and general inquiries. Mental health and safeguarding are behind where we would expect, but these are specialist lines, and staff redeployed or new to the team will need time to train and become familiar with the work before we can expect a similar improvement as on the other lines. The volume of assessments in October remained behind where we had aspired for it to be, and in October the year-to-date position is 1,639 assessments that have been completed, with an aim to have reached between 5,000 and 7,000 by the end of this year. Finally, registration timelines are improving. From a high of 61% of registrations being more than 10 weeks old in May, by October this had dropped to 38%. Chair, I hand back to you for questions.
Anything to add, Chris? Questions or comments? Belinda.
Thanks. I've got a couple of questions. So I know that we've moved away from the terminology of inspections to assessments. That's fine. But how many of those assessments involve an inspection? So I think it's important we have clarity on how many of those assessments involve members of our staff going into services. I also think it's important that of those physical visits, how many of those visits are done out of hours? And by out of hours, I mean proper out of hours, not just starting the assessment early and finishing late. And I think we really, really do need that clarity as a board. And just your views generally on why you think the assessments are so far behind.
Chair, can I pick up the a sort of assessment productivity point? Because Belinda, it goes to this issue about the interplay between the priorities we've set ourselves, the risk-based priorities for regulation, and the performance of our regulatory platform system. And as I was saying earlier in the Chief Executive's update, we plan to roll out the hybrid approach, which we hope will have a number of reduced steps in it, which will enable us to go out and undertake more assessments. And many of the assessments will be via the means of inspection, but they won't. Not all assessments will be inspections. And in the trial of the hybrid approach, I think we undertook around 170 in adult social care during a period of 6 or so weeks. During that period of time for the trial, we had examples of it taking around 17 odd days from allocation of the work through to publication of the report. So a much increased productivity from a really poor average in the last 6 months, well, actually the last year. It's that might give us some confidence that that number that's in the report, the 1,900 assessments, which is now gone up to 2,100, I think, but it gives us some hope that actually that will go up. And I was talking to a member of staff, Keshet, who was describing to me her absolute pride in being able to get out during that 17 days time, and the day after, day 18, going to another social care provider and starting again with that reduced process. So I think until we have as it were, a game changer, a more productive system, we won't see that number rise significantly. But our ambition remains the target of between 5 and 7, based on better tools for our staff, because they are absolutely chomping at the bit actually to get better regulation and better productivity out of the system. Many of those will be inspections, but not all of them. There will be examples where assessment is the methodology.
I agree with you, but I think we need to be very clear on because assessment is a relatively new term that we've started using over the past few months. Up until then, we always use the word inspection. And I'm not suggesting that every assessment needs inspection, but as a board, we need to be crystal clear. You know, we don't want to have a look at thousands. We've done thousands of assessments, and then we find out that only 200 of those have involved a physical visit. So I think it's just something we need to be mindful of, and especially in services where we know there's more problems, mental health, maternity.
Chris,
Can I,
do you want to put your mic on?
No, I was just going to add and just say, yeah, absolutely agree, Belinda, in terms of actually, assessment and being on site. But the other thing I was just going to answer is your question around what's the percentage of site visits of the inspections we've done, or the assessments we've done. By end of Q2, it was 78%. So in terms of actually being on site of those assessments.
Chris, you wanted to come in?
I was just going to say that at the moment, 78% of inspections, assessments include an inspection against a target of 75%.
I was just going to say it's in the dashboard, Belinda, on page 22 of Diligent. It says the assessments with a site visit. So it gives you the volume of assessments and then how many of those were the site visit. So it's in there. You're bit on out of hours, though. I think we need to take that away because I think that needs look. I think that works kind of paused at the minute. I think so. We need to look at that. Yeah.
Any other? Shine.
Thanks, and thanks for the report. Just a few things for me, particularly around prioritisation and risk. So when we look at the dashboard, we had a discussion this morning about sort of sorting it to the highest priority. So perhaps if we can do the same with the dashboard, the things that we have prioritised in the top right quadrant, we sort of highlight top of the scorecard, I think would be really beneficial. My other points relate mainly to risk, and obviously we're really delighted, Sean, with the work that the team is doing, and with the idea of a performance and risk committee to really get focus on this. I think it's fair to say that I would like to just add, because the ARAC report is out of sync with this, that we have raised some concerns as an ARAC with some of the risks that are missing off the register, and I think particularly risks like the significant backlogs that may result in risk of harm, or record keeping that may make it difficult for us to discharge our responsibilities. Things we're talking about regularly that are in that top priority quadrant that are risks don't feature. And we've also raised concerns around some of the scoring, things like benefits realisation, the quality of our data that we have in order to assess the risk of services, these kind of things. I think the ARAC feel that the risk scoring probably needs review. So both within the risks that feature and the scoring of those, we have asked the team to look more closely at that before the ARAC. Sean has made a suggestion which I think is really good. So it was asked as a question for the board, which is, can we add some categories around regulatory risk, governance, and I think it was performance risk. And I just would say, for one, I would support that. I think one of the things that's really important for us to do as a board is look at aggregate risk, not just the component parts of risk, because as we aggregate, the risk to CQC can be much higher than the individual risks, and I think regulatory risk is one of those. So I would, for one, if the board agree, I would welcome that and support Sean in that recommendation. So just wanted to note that we do think there is work to do on the risk register. It doesn't just sit with Sean and his team, and we need to be supportive of helping the team around the table and beyond to really make sure that those risks are the key risks for the business and that we are able to discuss them appropriately at the committees.
Thanks, Charmaine. So I'll come to you in a second, Mark, but just before we lose that, thank you for picking it up, Charmaine. I was going to ask, because we didn't put it down for approval, but you're right, there was this comment in there subject to board approval. I'm not sure it's formally needs approval or not, but I mean, I was going to come to you, so we've already got your comments. So does anyone disagree with the proposal, or can we just make sure we've agreed that? Okay, well, you've got your agreement you want. Sorry, Mark.
No, thank you. It is also, very, very helpful to see this as a complete dashboard. As we're entering into the phase where the key priority obviously is the recovery, the dashboard wasn't necessarily designed just to show us recovery. So what we have got as a priority, stabilise the regulatory platform, or work to make sure that people have got workarounds to get off the platform to do their work. And we're hearing some very promising anecdotal reports coming through that those might be helpful. The app discussion that we had this morning, it might be helpful to think through how would we see that in a scorecard, so that we can start to see not just very, very high level indicators of how many assessments or how many inspections we've done, but actually what is people's experience with the regulatory platform? Have we got more stability? How are we managing to do workarounds? I can't suggest the exact metrics, but actually thinking about how do we get a view to whether we're tracking in the right direction there. So again, helping us as a board prioritise where we're focusing energy, resources and support.
Yeah, I think that's a perfectly sensible idea. I think it's going to, we know that the recovery plans are multifaceted, so we've got the programme, we've got the non-programme sort of in the line activities, and we've got the work that's being overseen by the committee. So one of the things I have been thinking about is how do we put all of that together in one place, and I think that's a really good call.
We'll leave it to you, just make sure that we get a helpful summary, because some of this is lifting stuff out of recovery plans that perhaps we see elsewhere, but we don't want to duplicate effort. We also want consistency between what we're seeing from different sources, but I think it's a helpful
Chair, I think it's not about volume of reporting, it's again back to sort of prioritisation. If there are one or two things that we should be keeping an eye on as a board from month to month, it's how do we make sure that we're doing that at the recovery plan level, not just at the results of that level, so that you've got a bit of lead and lagging. This seems to be lagging, and we need to get a little bit into the lead indicators.
A couple of things from me. There were three, but you've dealt with one, Charmian, thank you. On page 20 of the diligent book we're using, this is the safety of care, there's a measure, and you say that there's been an increase in providers who say CQC regulation has led to my service improving the quality and safety of care provided to people. Seems to me that sits slightly oddly with some of the results from the not Vic Rayner, but Vic Rayner and her supporters, colleagues' reports this morning. That there's on the one hand, we're being told in a survey that people think we should be doing much more, and yet on the ground, when we ask surveys directly, we seem to have quite a high proportion of people saying making a difference. I just wondered if there's any way of connecting that. My second question will be to Chris, but I'll ask them both together. Somewhere in here, and the pages seem to be updated, but there was reference to the costs of inquiries. Maybe we'll deal with this one first, because I think just asking for confirmation I've got the understanding right, Chris. If I haven't, it'll be a longer answer from you. But the challenge we've got is this year, with so many inquiries going on, the costs are considerable. My understanding is that we've been told that we are not allowed to use fee income for that, even though that is the overwhelming majority of our income. Our only other source of income is grant and aid. Currently, my understanding is the department has said they won't provide additional funding. So the only way we can meet the obligations of the inquiries, and we're told we have to, is either we have underspends elsewhere, so we've been paid to provide another service, but for whatever reason we can't do it, or as a board we may have to make a conscious decision, should it ever come to that, not to do something that we are supposed to be doing, one of our regulatory responsibilities. Have I got our understanding right? And if so, can I just make sure that although these are relatively small sums in the scheme of our overall finances, we are very constrained in how we pay for them. I just want some assurance from you or James that we are not yet at the stage where the organisation is having not to do work it should be doing, and to make sure that if we ever get to that stage that the board will be kept informed. So I'm asking for confirmation I've got the understanding correct, and be clear that if there is any inability to carry out another activity, we will be told.
You've got your understanding correct, and correct in terms of we're not at the stage of standing anything down. It is a kind of recurring, long-standing issue as our inquiries unfold and more inquiries come on stream, that we're in this bind of we can't use provider fees, which is 90% of our income, and we haven't got any additional grant and aid. The cost of inquiries this year, and there's more than one inquiry we're dealing with, are about 3 million. We are in open dialogue with the department around that and around the pressure that brings us. So in conversations with the department about if there's any other budget lines that could be repurposed. We're not seeing underspend materialise on any of the grant and aid activity that we can utilise on this. So it's an open dialogue, but we're not at the stage of standing or stopping any other activity, and then we'll bring that back to board for a conversation.
Okay, so discussions continue, but you'll keep us informed. I mean, also, if anyone kind of listening behind the query, I mean, if inquiries to some extent, I guess, are a fact of life for a body such as ours. What's different this year is maybe two things. One is the sheer number that have come at the same time, and the other is that most of these things are very historical, but in some cases we're having to go back many, many years, and that is a massive undertaking for us to go back over 8 or 10 years worth of records, and that's where a chunk of the cost comes. Okay, I'm nodding. Thank you very much. James, sorry, were you wanting to add?
Well, I just wanted to echo the points, really, that we must comply with the law, we must comply with our own purposes and requirements on us. So in a sense, if we get to the point where we're having to, as it were, affect one of those two, then we'll have got to the wrong point. We have one of our regular quarterly assurance meetings with the department this coming Monday, actually, so we can express the board's concern in that environment. And I don't expect to get an easy answer, if I'm honest, actually, based on last year's experience, but we have a mechanism to escalate the board's concern.
Okay. So thank you very much indeed for that. That was my second question. Back to my first, how I square this report about our success in helping people improve what they do with the survey results. I mean, maybe you don't know, but any thoughts?
I don't think there's a dichotomy between what Vic's saying and this. I think I was at a meeting with the Outstanding Society recently, and there are some occasions where we go in and do an inspection, actually help an organisation move from an RI to a good or an outstanding position, and I think this probably reflects just that feedback from individuals. But I don't think there's much of it with what we talked about this morning in the private board and what we're talking about here. We recognise there's a long journey to go on to make our assessments as useful as they can be. But I do think there are individuals, and we probably ought to acknowledge that there are individuals, inspectors and assessors who go into organisations and do have a positive impact on those organisations and do drive a change in understanding and do drive a change in the way they operate, and that's reflected in this score. I don't think there's a dichotomy between knowing we need to do more and different. To Joyce's point earlier about how we develop and understand inspection characteristics in our work and make sure we've got a common framework between ourselves and providers. But there are good inspectors and assessors out there who are involved in that work and actually involved in it at registration when they're helping to guide organisations around their application to the organisations in the first place. I think it just represents that there are good performances out there, despite the fact we know we need to make some improvements in the way we operate more generally.
It begs a question, not for now, but if I'm sure you're right, and it is an inherent feature of surveys that the people that speak loudest are those with a bad experience. Certainly that's what I do when I fill in many of these surveys. It's just human nature, but maybe there's a way of seeing if we could make more visible to those who don't get it right if we do it right. Christine.
Thanks. Just really picking up the point below the one we're talking about at the moment, which is understand the volume of assessments, including learning, improvement and innovation, and use the outputs for wider learning. What does that mean, and what do those particular numbers mean, and how are we using the outputs for wider learning?
Chris?
Perhaps I can give an example of it. You'll know recently we've completed a round of maternity inspections, so they're looking at individual organisations around the quality of care that they provide. But as part of that, we produced a guide for frontline staff who are providing maternity services, which is a sort of use the information we gather from those individual inspections to offer practical advice about how they improve their practice, sort of drawing from the best, if you like, to offer a view. So that's an example of how we use that. I think James talked earlier on about the work that Prem's doing in terms of urgent and emergency care. That's another example of it where we're trying to draw from what we know from inspections to guide people back to what they can do differently, what they can do better.
So is that those numbers, 379 for this period and 142 for the previous, that's those types of inspections, or is it general inspections?
So I think it's all inspections, but I'm thinking particularly where we have a thematic focus on inspections, it tends to generate more of that feedback on the basis. So there will be individual inspections. I can think of two recently I was speaking to colleagues about around community mental health, where the inspection team has provided information, advice and support, but it tends to happen more frequently where we're looking thematically at an inspection process.
I think it also amplifies some of the wisdom built into our assessment framework with particular quality statements, so we can look at innovation across the piece by noting the number where we've used that particular quality statement, which may indicate what the number is. I'm not sure. Joyce will probably know better than I, but it may be that's the number of quality statements, number of times that quality statement has been used, which is what.
Don't have to add, but I was sure. All right. Well, if there are no more comments, thank you for that. For the benefit of, again, people listening in, I'm essentially absolutely clear nobody likes the fact we've got this completely covered in red. So the fact there aren't people jumping up and down doesn't mean to say we're happy with it. It's just that what we are getting is if you look at the quality and I think accuracy of the information we get now compared to even 12 months ago, it's considerably different. So we should thank you for that. It's continually improving, and there are discussions elsewhere as to a lot of this is driven by the problems of the last year and discussions elsewhere in the recovery plan. So it's probably just worth making that point. But thank you very much indeed.
Thank you very much, and thank you to the team for putting it together.
Jackie, we just move straight on to you. So we have your People and Culture Assurance Report. I say it every time, but I'll say it again. We have read it, but what would you like to highlight?
Yeah. So, rolling report on the key performance indicators. Apart from the vacancy rate, you see that there are some improvements, some of them albeit small, in terms of moving things forward. There's still work to be done on workforce representation, but against the backdrop of what we're working through, I think we can take some comfort in some of the reported metrics. I want to specifically focus on vacancy rate through the lens of recovery. So, working with operational colleagues, we have really ramped up the recruitment into operations. So we have got 37 inspector roles left, and we've had 1,256 applications with 300 assessments taking place at the moment. Colleagues, big thank you to colleagues across the organisation who've helped with shortlisting, assessment review and interviewing, because I think whilst we can look at it from a resourcing perspective, but I think we've got to broaden the view, because if we can fill the vacancy rate, the capacity will improve next year, and also that team spirit and the impact on colleagues who are already in the business, who have been maybe carrying more than their own workload because of vacancies. So I think pretty confident that by the end of the year, we will not only have completed the vacancy fulfilment, but also will have a pipeline for next year when there's maybe some more clarity around specialisms, chief inspectors, and also some of the direction of travel. So that certainly was a real collaborative effort across the organisation. The other thing I wanted to just bring live was the sentiment report. I think that's been pretty sobering reading, but it's something that we'll need to continue, because we can learn regarding our communications with colleagues. Is the recovery plan clear? Is it understood? And you know, the difficult reality is we probably knew what certainly the first survey was going to say, and we just need to keep on evaluating and critiquing it, and how we can plot what colleagues are giving us in the sentiment survey, amongst other feedback channels, as to how we communicate and give clarity to the recovery plan. Just going back to the point on wellbeing as well, Charmian, we have got in the management and leadership programmes, there is a part in wellbeing in there, and actively encouraging completion of risk assessments as well, so we can act upon that. So, you know, wellbeing is on the agenda all the time in terms of how we can enhance and support that, looking at what we already do and what more can be done. And just to round off with continuing the conversation around resourcing, we know that there's work to be done with improvement to the recruitment and resourcing model, but I've had to prioritise how I can use my resource on the recovery plan, certainly over the last 3 months. However, I have got resource to start and look at how we can improve our resourcing and recruitment approach from January, February onwards. I know that colleagues in the equality networks are really keen to be involved in that. That's something that will absolutely give one of our first priorities, because we do have to sequence and how we approach this, because actually the capacity, capability, strategy and direction of the organisation, underpinned by values-based recruitment, need to be known before we can head fully down that track. So there is some preliminary work we can do with our equality colleagues, our trade unions, to start the conversation, look at the report that we have had prepared by a recruitment psychologist, and to really understand what the desire and ambition of the organisation is. But there is some fundamental requirements from the organisation before we can fully fulfil that. So I think that was my sort of like 2 or 3 updates. I'm happy to take any questions.
Thanks. I don't have a session where we kick everything down the road to Julian, but clearly we had a discussion with him the other night, and some of this stuff is number 1 priority. Charmin, I'll come to you in just a second, but Amy, I'd be just interested whether either personally on behalf of the networks you have any observation or anything to add?
Yes, thank you so much, Jackie, and thank you specifically for sharing the commitment to involve the equality networks and the trade unions when it comes to recruitment and moving forward to ensure that that is an equitable process. I really wanted to pull back for a moment to the sentiment survey if we can, and I understand it's a difficult data to digest, but significant and important data, and specifically thinking about poor communication and colleagues not feeling that they're informed about programme changes, probably a number of programme changes that directly impact them. I feel like there are a number of nuances there when it comes to the diversity of our workforce and the diversity of communication needs that people may have. So I wonder what the commitment or planning may be moving forward when it comes to ensuring that there is an engagement with our colleagues that allows for an equitable access to communication moving forward.
Jackie or James?
Well, shall I go first, if that's okay? It's a really important point, Amy. One of the most important things for me is probably the person that knows an individual best is their immediate line manager. And one of the things that we want to do through the communication process is to make sure each level line managers really understand not just what's happening, but why it's happening, and are able to digest it so they can then talk to and in conversation with their teams have the right conversation. And that might be in a number of different forms, as you say. Not everybody will respond well to group meetings. They may want individual conversations. They may want to have it in different forms. So for me, I think hopefully by making sure we've got the right information, then drawing conversations through the line of communications from SLT 30, the wider leadership group, operational managers, through to inspectors, and in fact others that sit across the business. We're giving everybody that leads somebody the opportunity to understand the messages, translate them into something that's useful for their teams, then to hear the feedback from their own team to bring that back into the programme. And that will form a regular cycle of communication. And for me, there's something very powerful about giving responsibility and ownership of that to managers, but then ensuring we can hear back so we can adjust and change the programmes as they move forward. But it's a really important point you make, and it's a really important point that we've got for the future. I think we've relied too much on central messages that have been cascaded out in either in very large groups or even through email communications. I think we've got to get back to tailoring and targeting the information for people based on people that know them best.
Thanks, Mark. There's a helpful challenge, helpful response, but some things to think about. Charmian and then Mark. I'll come back to you, Joyce. Charmian, Mark and Joyce.
Thanks. I have one for you, James, and a couple I'll start with Jackie if I can. I was just interested in some of the data, if we can just understand a bit more, please, or just a reflection. So we're seeing, in terms of the exits, we're seeing a much higher proportion of our minority ethnic groups than the average. So just interested in understanding, we talk about two of the categories being non-disclosed and lack of opportunities. Do we have a feeling for, what of the difference between the 8.5 average and the 11.3 relates to those two categories versus the others? And then I guess quite concerning is some of the reasons it's really useful and rich data, isn't it, around sort of that dissatisfaction that sits with workload management and people leaving for organisational reasons and well-being concerns. So I think we're seeing an increasing trend here to some of the things that our leavers we can do more about. So I'm wanting to sort of understand a bit more about what we're doing to follow up with some of those. So if we have colleagues leaving for org reasons or well-being concerns, are we following up? What could we have done differently? What was your well-being concern? Because that 20.8 is quite high for people to be leaving. 1 in 5 leaving, because they don't feel their well-being is looked after. And also workload at 37.3. So that's one thing. James, I guess the other one for me, you won't be surprised because I think I've raised it every board since I've been here. I really worry about our mandatory training, and we've asked a number of times for the pathway to compliance, and I was just wondering how are we going to see that pathway? These are legislative requirements, regulatory requirements, and it would be really nice for us to have that back, that pathway by directorate to compliance around things like health and safety training. We've got, you've highlighted the low results in terms of cyber and database training, and we've just had an unsatisfactory audit. So these things are tying in health and safety training, people leaving for wellbeing, poor audit results, low training results, and I think it would be nice to see some commitment to that pathway.
Okay, so I think it's Jackie and then James, but if you could try and keep it brief. So,
Yeah.
Mark, do you want to add to that?
To add to that, fully agree. And for some of these, for some of the mandatory training, the training and awareness is our key control in terms of, directing discretionary behaviour around the organisation. So some of these, without people doing the training, we have really quite limited controls in place. So they're essential. We also have other interventions. I'm thinking of the commitments we made earlier in the year to provide some additional training for our colleagues involved in inspections, following up on the learnings and insights from the coroner's report on Ruth Perry. And of course we have another load of training that we've got for colleagues around new ways of working across the organisation. So I think it's really important that we decide what is absolutely important, that we deliver on that to consistently high standards, and these numbers are not good enough. But we've also got to accept that we may have to clear the way with some optional training that actually is not mission critical, is not top right corner in terms of priority, and put some of that off, because we need to make sure that the overall training load for people at a time when everyone is under a lot of pressure is reasonable and realistic.
Combines up to two very big questions, but if I could ask you to do them quickly, and then Jackie, do you want to go first?
Yeah, so I'll just come back to the exit interviews first. So David very kindly helped me think through sort of like a pilot of the exit interviews, which is what you're seeing now, because actually we went through a phase last year and beyond where everything was, or a big percentage was not disclosed, wouldn't say. So I think we are starting to see that we're able to drill down and get more data around the reason for leaving. I think the bit that we're still to crack is getting the information in quickly, because once somebody's left, we can't have those conversations. And whilst we still follow up when colleagues leave, they're probably less engaged to elaborate or expand. It's pretty one-dimensional, the conversation. So I think we have made leaps and bounds with terms of getting specific data. I think what we need to concentrate now on is that follow-up and what the path back and forward is, with operational management and the conversations we have. So, I would hope that as we go through next year, that should give a much better picture and actually some dialogue around how we approach it after we get the information. So I think that was the exit interview. So I don't think there's anything else.
Just on the mandatory training point, so we are in campaign mode now until the end of December for that. So there's a message on the home screen which keeps popping up reminding us to do our mandatory training, and we have prioritised a list of 5 compliance courses that we require people to do. But like you, Mark, I have to balance, I suppose, the realism of people finding the time to do that with the recovery message that we're giving them about engaging on work. And I know one is a hygiene to the other, actually, but I just want to be realistic about expectations for that. Don't want to send a signal through this meeting or through my speech to say it isn't important, because I think it is, and that's why we've listed the priorities for people to undertake. And you might, again, balancing, you might expect colleagues to, during the holiday period, as it were, use some of that time to catch up on mandatory training. It's a thing perhaps we shouldn't encourage, but it's a realistically thing that we all do. But again, we need to balance the need for downtime for our staff during that holiday period versus compliance. So I think we're in a tricky place. But as a leadership team, we've set ourselves a target for the end of the year for compliance, and we'll be able to come back to the next board with the outcome of that.
I mean, the other dimension to it, of course, is not everyone, some of these training elements are more relevant to some people than others, and if people doing it are asking the question, well, how does this apply to my job, then they probably shouldn't be being asked to do the training. Everyone's a cyber guardian. Not everyone is involved on a daily basis in situations that might give rise to safeguarding risk. So we need to work out what's important for everyone. I would also encourage the old-fashioned trick of making sure that there's a league table. League tables are visible around the place. There's nothing like being in the bottom quartile for this sort of thing to encourage people to make it a priority in their areas.
Can I just, we won't have one of these sort of reports for about 6 months, so can I find a way, well, firstly, of the action of just asking you to make sure that we've done the sort of things that talked about of prioritisation and the right people get the right training. But if we finally get a way of giving some visibility of that, I'll pick up with you offline as a minimum at the next board meeting, but rather than, I don't think we need to debate on it. If it's being done, it's being done, so we'll circulate it offline if necessary. I'll come to the last two comments, then we should move on. I think it was Mark, I was going to go to Mark Chakravarti and then Joyce.
Yeah, mine was actually just a quick move back to the sentiment survey. So I think that the two comments we've had so far, which is making sure we acknowledge the audience's diversity in the communication, and also I think the leverage of the immediate manager, both are very welcome. The other bit is just tying the 2 points that we have here, which is poor communication and unclear program direction. Those two are very linked, because essentially this is about promises in a situation of uncertainty. And there are very specific, I think we should also think, particularly as we engage the immediate managers more, there are very simple, not difficult training and skills about how you can make acceptable promises in a time of uncertainty that create confidence, rather than vague promises or overcommitments that create disengagement and missing expectations. So it might be worth thinking through how we can actually add that, and it doesn't have to be complicated.
Joyce, sorry.
I was going to say something similar on communicating in a time of ambiguity, that actually you need transparency and you need clarity. It sounds like the two things are the same, but it's slightly different. Transparency as in, how have you made those decisions, who was involved, how does it affect me, and then clarity as in what do you know will happen and when, but what do you don't know, and you almost have to narrate your leadership to walk people through the process in your thinking, because the ambiguity is really difficult for some people to deal with. Other people can flex within that as well. But there was 2 points. I think what you've talked about, Charmy and Mark, and what this data talks to, is that there is an issue of well-being, and I think we as an exec team will take that. I think we need to properly look at this in more detail and think about our targeted responses to well-being, because I think we've got people who are on the trauma side of what where they are and what's happening. Other people who are saying, I'm just keeping my head above water and I'm struggling, And then, there are other people who are probably in perhaps a better space, but also want to help colleagues who are not. And I think there's a targeted approach that we should be taking across the organisation to understand it. And one of perhaps the key performance indicators we could develop, because we've got indicators which are sickness and vacancy, but we haven't got one that kind of tracks well-being, and we need to, even if it's a composite of the sentiment and then something else on well-being, I think we need to track that to make sure that we really understand what's going on with colleagues. And then the last point, Jackie, is a minor point, but some people will pick this up. Under our key performance indicators, we have some that say over 10%, and then we have some that are exacting. All the ones around ethnic minorities, disability, and the protected characteristics are exacting to align with the labour market. Actually, we don't want to just align, we want to be better. And our RES, our workforce, I just call it RES, and our REDES, which is the reporting we do on race and disability, always talks to be at least aligned with the labour market, to then be better. Because as a regulator, we serve communities which are vulnerable and ill-served and have a lot of protected characteristics. So we can't just be at the same percentage as the we actually need to be over and above that. So that's just to match what we do in our national reporting statistics. Our board report needs to say, it's quite easily done over, and you could even set a higher target as well. So just to update that.
I mean, your last point, Joyce, it's, we're going to be into business planning season fairly soon. It would be, I mean, this is a report against the agreed metrics. I think it's a very good point. But we should be clear we set an ambition along the lines you're describing and build it into next year's business plan. Unless there are any other burning questions, I would like to move on. So, Amy, last one.
Sorry, just a brief one from me. Thank you so much, Joyce, first and foremost. Absolutely agree with the sentiment that you just shared. I'll keep it very brief, Jackie. I want to pivot very slightly to look at reward and recognition, something very important right now for our hard-working, very resilient colleagues at the moment. I note, and I'm very happy to see that reward vouchers awarded are currently in an increase, and I'm also very happy to see that vouchers among disabled and LGBTQ+ employees seems to be aligned with respective percentages. I was concerned to see that this is not also reflected for people from an ethnic minority group. And I was just wondering, and in line perhaps with some of the things we've just discussed, what planning or what action is in place to try and understand and address that at this stage?
I think this is quite a difficult one from a people perspective, because it's very much dependent on line management, recognising. I think we've all got a responsibility to take here in terms of recognising the purpose of the awards and how we can increase it. We can look at some communication. My business partners do prompt on a regular basis, but if there are ideas from the networks, I'd be more than happy to have a conversation about it, because so much of it's unseen. You're relying on people recognising and actually physically saying, this is what I want to do with the reward. So, anything that you can help with would be greatly appreciated.
Thank you so much, Jackie. And yes, I think there potentially is a piece of work there with the equality networks, and also empowering our line managers to feel quite confident when it comes to recognising and appropriately addressing their colleagues when they've gone above and beyond, or just get on with the day job really, really well.
Yeah, I would agree.
Okay, thank you very much. Let me deal with one final matter before we take a comfort break. And this is mainly for the record confirmation of having followed all the good practices, but probably worth saying it in case anyone's any questions. So, in summary, but going back to history, we announced in June a new interim chief executive, but said at that stage we would in due course run a process to make that post permanent. We did run that process in September, as I think I've reported before. The then interim chose not to apply for the role. We had a huge amount of interest and a number of really very good candidates. There was a panel which I chaired, but some of my colleagues here joined me on the panel, which I think was both very experienced and suitably diverse. We also had a Director General from the department as an independent panel member sitting with us. I said it was good interest right across the piece, but we also ended up with a high quality shortlist. So Julian emerged as the panel's recommendation for that. Everything had to be done in accordance with the approvals that we were given by the department at the beginning of September. And we have complied with everything all the way along. Julian, we announced his appointment in early October based on the recommendation of the panel. We have managed to negotiate with his current employers, NHS providers, and I probably should give a word of thanks to them actually, that they have agreed to release him quite a bit ahead of his normal terms of notice. So as everybody knows, he joins us next Monday, the 2nd of December. And just to complete the formalities, you would expect him to become a member of this board, but that does have to be approved. So the NED's non-executives met last night, and we have unanimously approved him as the, not just as the new chief executive, I'd already signed the offer letter, but as the chief executive and member of this board. So he joins the board effective Monday, and we have told him. So that's really just a quick run through to be quite clear. There's a lot of process and stuff, but it was all followed very rigorously, I believe. So unless there's any questions, let's take a comfort break. We're about 10 minutes behind schedule, so if you could keep this to no more than 10 minutes and come back at 10 to 4. Thank you. Welcome back, everybody, to the final 3/4 of an hour or so of the CQC Public Board meeting. We've just two main matters on the agenda and then some updates and reports from board committees to follow. We're joined now by James White, who's the Director of Corporate Provider and Market Oversight. I think people are familiar with what it does, but James will give a very brief introduction. James, I think it's the second time you've joined us. It's such an important function of CQC. One, people talk about us, they often don't realise we do. So I think James Bullion just wanted to give a brief word of introduction, then we'll hand to you. People have read the paper, so don't need to take us through it, but if there's any particular high spots you want to mention, and then we'll go straight to questions. Thanks.
Thanks, Ian, and welcome to James to the meeting. I wanted to just say one word by way of context, and really with my, as it were, normal hat of Chief Inspector of Adult Social Care on. I've been in a number of environments in the last couple of weeks. For example, yesterday with the National Care Forum and about 120 or so chief executives. I've been at the local government sounding board recently and have been in our own engagement meetings with providers. And there is something of a really strongly growing level of concern about the financial position of adult social care providers. Of course, we have a formal oversight role, which James will cover in terms of our role, but broader than our role, I'm concerned as Chief Inspector about the potential for the impact of costs and changes for adult social care providers. It's expressed by the providers, it's very clearly expressed by the local government sounding board, of which we are a member. The gap between, as it were, the allocation or the probable allocation of resources and the probable costs, or rather the definite costs in local government around adult social care in competition with children's social care, as it were. And then thirdly, from our own local authority assurance, we're picking up in the commissioning work that we look at, really a bit of a gap between the aspirations of getting the right amount of care for people and the financial constraints, as it were, or the limitations of the workforce and the market costs as well. So in three areas there is grounds to be concerned. I'm formally concerned as Chief Inspector, but wanted to place that as some of the context for James's presentation on the market. Thank you.
Okay, thanks, James. And then to other James, I say we take the papers read, but I appreciate yours is very short and just a few slides. So by all means, if you want to use the slides briefly, but I would like to leave most of the time for questions.
Duly noted. Yeah, look, just to give you some context with regards to market oversight and that period to 30th June 2024, there's 61 providers within market oversight at that point in time, which roughly represents 1/3 of the volume of adult social care within England. So a really critical part of the market. Those 61 providers are split pretty much equally between care homes for older people, home care providers, and also specialist providers. And when we speak to specialist providers, they predominantly look after people with learning disabilities and also autistic people. In terms of just some key trends I'd like to highlight, I suppose the first one is care homes for older people. This has been a real pleasing trend which has really developed since coming out of COVID. Occupancy levels have built back up slowly and steadily, and as at the 30th of June 2024, they're now at 86.8%. And where that's really impactful is we estimate break-even point in terms of financial performance for a care home is around about 85%. So that's really pleasing. In terms of home care providers, one of the trends we've seen within a subsector of the providers within market oversight, and that's roughly 40% of those providers. These providers haven't grown their businesses by taking over any rivals, and what we've seen in relation to their hours of care delivered, we've seen that actually contract over the last 2 years by approximately 5.5%. And what those providers are telling us is that's mainly down to recent changes in LA commissioning practices, whereby LAs have sought to have, or some LAs have sought to have more providers on their home care framework, and that's one of the reasons to give people more choice for care. But conversely, what that can mean for the market oversight providers is they may obtain less hours from an LA, and if that is the case and they're not satisfied with either the level of profitability or they've moved into a loss-making position, they can make the decision to shut a branch, and ultimately that may mean that the provider is smaller in terms of volume of hours but equally profitable. The last subsector I'll speak to is those specialist providers, and look, I think it's fair to say over the last couple of years they've been operating in a difficult business environment. EBITDA margin, which is a proxy for profitability we use, it's at 17.6% as at the 30th of June 2024. That's only 1.3% higher than 2 years previous to that. What providers are telling us is, notwithstanding agency use has more than halved, and it's presently at 6% of total staff costs amongst specialist providers, it does remain high and embedded in certain services in certain parts of the country, and that has a real impact on their profitability. The other important point to note with regards to specialist providers, those providers in market oversight, approximately 98% of their revenue comes from either local authorities or NHS funding. And what that means is, in terms of wanting to pass on increased costs to self-funders, which other providers have an option to do, that really isn't an option for them in terms of the materiality of those self-funders. I'll just cover the outlook for providers before finishing off. Look, in these winter months, traditionally care homes for older people, we've seen a retraction in occupancy levels, so we're doing a lot of work with our providers to understand what's happening with their occupancy levels within the winter months, and that's due to, I suppose, more winter-focused diseases such as flu and norovirus traditionally impacting their occupancy levels, which has a real impact on their profitability. And finally, with all providers within market oversight, we're working with them to understand what does it mean for them, the increase in national living wage and employers' national insurance costs from the 1st of April 2025, because that is fairly substantial. And what those providers are telling us, they're looking at taking certain actions. They're thinking around how can they reduce agency costs further, can they obtain efficiencies by better staff rostering, can they pass on costs to self-funders if they've got that business model, and are there any overheads they can take out of their business. Market oversight providers are telling us that they're doing a lot of work on contract by contract profitability in terms of their local authority work to understand what sort of uplift they need from the 1st of April next year. And they're also telling us that they're wanting to have conversations early with local authorities to understand what uplifts they may be having. I suppose my final point is all of the providers in market oversight, and I suppose all providers within adult social care, want to remain financially sustainable in the long term. And what the providers in market oversight are telling us is that if LA and NHS uplifts are not sufficient to enable them to remain profitable in the long term, they will have to seriously consider contract handbacks or serving notice on contracts in order to be able to continue to deliver care in the long run. Thank you.
Thanks very much, James. Just before I hand over to colleagues, just to be clear, I mean, obviously our prime responsibility in market oversight is to look at the financial condition of 60-odd organisations. Am I right in saying, because obviously I see things that are beyond what's at the board here, that our overall assessment, or as of today, of people in that programme is not dissimilar to last year or so. So there's no flashing red on that. On the other hand, both what you and James have said is going beyond that. We do see people saying, well, we know for a good reason they're going to be under greater financial strain. They say they would consider things like contract handbacks, but I think we're actually seeing some early evidence of that. So am I right on both of those broad assessments?
Yes, you are, and I think ultimately no provider wants to hand back a contract if they can avoid it, because ultimately, you know, some of these people, they may have cared for them for many years, and it's a massive step for them to have to make. But look, they certainly understand that if that's a necessity, it's something they will have to consider. But no one jumps into it, and no one wants to do it without a very good reason.
Thanks. So any other?
I mean, very, very, very helpful, comprehensive report. I think that the outlook, particularly with the sort of national insurance contributions and the minimum wage, are going to be critical. Are we tapping into other organisations' research on that, or are we relying on our own sort of primary research to do the modelling as to what it would look like in the future? Noting that I think the King's Fund did something very recently on it with a breakdown of what that would cost and how that would play out. I wonder if we could take that data and apply it to the subset that we're monitoring in this particular section.
Yeah, look, I've certainly had conversations with Care England to understand their modelling and if it aligns with our own. And look, it broadly does, and it also broadly aligns with the Department of Health and Social Care in terms of their modelling. In terms of April 25 onwards, you've not only got national living wage increasing and national insurance changes, you'll have your usual inflationary pressures as well with regards to, you know, a care home for older people, consumables, food stuff. Thankfully, we are operating in a better inflationary environment than what we were in 2023, so that's less of a stress on these businesses. But I'm fairly satisfied with our modelling in relation to what sort of cost pressures providers within market oversight are facing from April next year.
Chris, you wanted to add, and then Christine.
It's a great report, James, and one of the things we did in Safety Care last year, we want to do in Safety Care next year. This affects organisations differentially across the country, so it creates areas of the country which are more susceptible to the chance of contracts being handed back. And I think it would be one of the things we're going to try and do with Safety Care next year is to look at both the likelihood of that in different areas, but also the implications of people who use services, because these organisations form part of a network that people will use to access care, domiciliary care if they're leaving hospital, potentially longer-term care in residential and nursing care. So I think it's a really good, it's a great report, and it's a great insight into some of the issues. There's one point that you highlighted around LA's growing the number of organisations that are part of a pool. There's a real strong sense that it resolves something for a local authority and creates a problem for a provider. And I think there's something about how the market management of local authorities' responsibility for that, how they begin to square that circle, because there's a logical ration. If you're a commissioner, you can see why you do that, but the implications of it for the way the market will change in the medium and long term can't be ignored, and I think there's something we need to think about in terms of our messaging around safety care. But great report, so thank you.
Just pick up that point before I hand to Christine, but you say it's logical, but the risk is that unintended consequences means it has the opposite impact, because if you get people withdrawing from the market, you end up with less competition rather than more, which I think is obvious. The other thing I thought you were going to mention, but it's probably worth saying, really just an observation, because again we look at this in more detail, is it does depend on the staff mix, which of course is different between different people in different situations. So there are three pressures. One is the national living wage, one is the percentage increase, but perhaps the unknown, and often for some employers, the big issue is the reduction in the threshold. So we were looking at some things the other day where, a company had the majority of its employees were full-time, it had a minority of part-time, and yet the financial consequences of this were roughly equal because of the reduction of the threshold, which starts building into part-time workers. So I guess it will also have implications for the way that employers wish to structure their workforce to the extent that others are available. Christy.
Thank you. Several points really. First of all, picking up the point about the framework, my perspective on it is slightly different from the one you presented, which is that it's often not about choice for the service user, it's actually about managing costs for the local authority or the commissioner. And they will tend to, in my experience, they will tend to go for the lowest possible price they can rather than the provider that the service user might choose. And that might be something we could pick up in local authority assessments. And then leading on from that, we know that 85% of adult social care providers are small and medium-sized enterprises, which obviously don't come within our remit in market oversight. But those are most often the providers who are providing socially funded places, i.e. the people who have less choice because they don't have their own funding. They are probably going to be most affected by the things we're talking about around national living wage and national insurance increases. And although it doesn't come within our sort of reporting remit, it's something that we need to, as James and others have highlighted, we need to keep on the agenda, because we're potentially going to end up with a lot less socially funded places available or socially funded care available. And then finally, the specialist provider point, which really concerns me. I had sight of a list of the deficits or surpluses for a number of specialist providers, not all of which will be within the portfolio that you look at, but I would say 70% of them were showing losses from last financial year, which is before the impact of April 2025 changes. So there is a potential real problem coming down the line that we need to be aware of. Is going to affect our work, and it's going to affect social care provision generally.
Yeah, and look, Julie noted in the point around specialist providers, traditionally there's been a decent percentage of them have been not-for-profits, charities, and that also applies for market oversight. Roughly half of them are not-for-profits. They've never really been in it to make money and pay a dividend to shareholders. They seek to make a reasonable profit and reinvest it in the business and hopefully grow their services over the years. And look, I can agree that the margins are not great, would be the kindest way of describing it. So, we're working with them to understand what levers they can pull come April in terms of being able to deal with those increases in costs. And I think the other point to note with those small and medium-sized providers which sit outside market oversight, they've probably got less options, or they're less mature businesses than the businesses within market oversight, where you may have built up some reserves over the years. You may have some quite understanding financiers. You've probably got a more experienced executive team who have been through difficult times before. So look, yeah, we completely agree with your point around that broader sector in ASC, just not market oversight.
Yeah, and I think the point about some of those specialist providers is that their reserves will have been considerably depleted over the last few years already, and the impact ultimately it's a logistical issue that obviously local commissioners and national government need to be aware of, but the impact ultimately is on continuity of care, and it's particularly important for that group of people because it is a long-term, as you said, it's a long-term care provision.
And look, with that point in reserves coming out of COVID, where there were real staffing pressures and agency spiked, we've seen reserves decline over a period of time. So you could probably say most providers going forward into next year aren't in the position they may have been, say, 2 years ago.
Okay, David.
Thank you, Chair. I think there were 2 points. A apart from thank you for the presentation, which I do. First thing that I'm noticing at the moment is that, you know, the traditional move by retailers towards the Christmas period of taking staff from the care sector seems to have become much more aggressive in two ways. Firstly, they seem to be not just topping up for Christmas, but they're actually offering considerably more money with a view to getting people who will then stay with them as retail staff. And of course, that's quite a big impact upon the sector. And the second point was that an increasing move for residential homes, many of whom have offered a home for life as one of the, you know, original promises made, who are extending their capability or claim capability from, you know, elderly people to frail elderly, to people who would need much more support than that, and particularly in one of the fields I work in, into taking dementia patients when they don't really have dementia units, you know, specialised nursing units for people with dementia. And I just wondered if you, on those 2 points, you had any particular comment to add in terms of market oversight.
Look, we do have a lot of engagement with all providers around staffing, because ultimately, you know, 80% of your costs for home care is staff related, roughly 60 to 65% for care homes for older people, and ultimately vacancy levels within adult social care run at roughly 3 times the broader economy, so they're always competing with retail, leisure, etc., on a war on talent to a degree. I think the market oversight providers over the last 2 years have got a lot better at staff retention. Their turnover levels are slightly down. They've got a lot better at rostering efficiencies in order to drive down agency. But again, they are large, mature businesses where they have a decent standalone HR function. But notwithstanding that ability to improve staffing efficiencies and rosterings, that does come at a cost to the business as well. That does cost them money, but certainly skills for care. I think the most recent report, the vacancy level has come slightly down, but as I said, when it's 3 times the wider economy, it's always going to be a difficult place to play. In terms of, I suppose, higher acuity in terms of residents in care homes and nursing homes, our providers tell us that they're still looking at the average length of stay in a home is still roughly 18 months, but we certainly have received feedback that certain residents coming into the home are probably higher acuity at first coming into the home than they have been, say, 5 years ago. And what that means for those care homes is they need to make sure that firstly they've got the staffing levels and the staffing mix right to be able to offer, you know, good quality care, and also as part of that they've got to make sure that they're charging a consummate rate based on that acuity level, because if they're not, that also creates issues for them around long-term financial sustainability.
Okay, thanks, James. If there are no other questions, we'll close down. James, thank you very much indeed for that, insightful as ever. Joyce, I mentioned at the beginning of the meeting that we were moving for this afternoon a separate paper on Ofsted, as it turns out. So what we try to on these occasions just make sure we're aware of something going in the market and the implications for us. So the paper we're looking at is to do with Ofsted and their decision on the use of one-word ratings. It's a fairly short paper, and we have read it, and it's for note. So is there anything you wish to add? I thought the paper was pretty clear, actually. But anything you wish to add, and if not, we'll just see if there are any questions.
Yes, first of all, I want to introduce Vicky Howes, who's here from our strategy team, who helped put this paper together. I think, as you know, we've put this paper together because of the increasing amount of feedback and awareness around the use of 1 or 2 word ratings, the fact that we use ratings for choice, performance, and to describe the quality of care, and the changes that Ofsted made, government made in September around scrapping the rating. But I'll hand over to Vicky if there are other points that you want to add before questions. Thanks. Sorry, apologies. There has been a debate for a number of years about the use of one-word ratings and whether they adequately sum up the complexity of some of these institutions and whether they mask good and bad performance. As Joyce mentioned, following the tragic death of Ruth Perry, this debate intensified, and Ofsted ceased using one-word ratings in September, and they're now undergoing extensive engagement and consultation to produce a scorecard report. We introduced ratings in 2014. We introduced them on the basis that they improve accountability, they can drive improvements in performance, they are used to identify and prevent failure, but really importantly, they're there to aid choice and public accountability. We know that the calls are continuing for review. We've seen it in the Dash report and the Richards report, and we need to do a considered review that takes into account the reasons why ratings were brought in, undergoing extensive engagement, particularly with people who use services, as to what they need to make these reports accessible and fair. And also, if we do decide to change them, we will need to undertake a public consultation.
Yeah, and consultation with the department. 'Cause, I mean,
of course, yes.
You said we started in 2014, but I mean, none of us were here then, and most of us weren't, certainly in the board. But my understanding was that it was ministerial preference, to say the least. So we would have to take into account the views of the current Secretary of State as to what he thought. So I think what you're saying is the pressure is such that we have to look at it, we have to have a view, but we can't actually do anything about it until we have views from others. Just one quick query from me, and then see if anyone else has any. I was struck just from discussions with others, including Ofsted actually, that the challenge you get if you put something in place for one reason and then it's get used for another. So when you described why this was put in, you didn't say that it's important for procurement decisions, which is what it has become in adult social care for local authorities, which is different from a private buyer saying, do I want to go to a care home A or B? And in the private medical centre as well, where we know that insurance companies use these ratings for contract purposes. So something that was designed for one set of purposes is actually now being used for another. So I think that if we're looking at it, we probably need to draw a distinction between the differing purposes. This is a question, not a statement, but there's always the risk that if you design something to do that and it's used for that, that actually it's not. If you were starting again, you wouldn't design this system to do with that. So you get my point. So I think we need to look at all the uses and consider that, because there is a risk that what we're doing is being used for a purpose which it wasn't designed, which is certainly what I think Ofsted found. So I'll leave that as a request. But if you say work is ongoing, any questions or comments from any of my colleagues? You hit us at the end of an afternoon, so thank you very much indeed. But it was pretty clear.
I just wanted to make one point, that the paper helps to position where we are as an organisation, because we've had increasing calls for, can you change it? And it's not an easy change, as Vicky's just described, and as you point out, it's a more considerate thing that we have to do rather than a quick win that we can do as an organisation. So the positioning, I think, is helpful, and doing it in public board is helpful too.
Thanks, Joyce. This light seemed to be going off at the end of the roof. It carries on with you in darkness. So, thank you, Vicky. Mark, over to you, the RGC report.
Thank you. RGC met at the end of October. For anyone listening into this who has not heard about this committee before, we look at the design, delivery and effectiveness of our regulatory model. Our sort of conventional way of working as a committee has been rather overtaken over the last 2 or 3 meetings by a focus on the significant operational issues that we're facing. So, our discussions have been a lot around delivery. And I'd like to sort of call out our thanks for, this meeting in particular the discussions were really greatly helped by significant improvements in the sort of, in the transparency and clarity of the information that we had at at the committee. So thank you to everyone, Steph and others who were involved in that. Amongst the issues we looked at productivity, which still sits well below expectations. But we also need to, within that, to ensure that the sectoral mix is right, and reflects the intentionality of how we're wanting to go and see the market. We spent quite a lot of time looking at the backlog of registrations, which still sits there despite a significant investment in resources. And a particular concern to the committee has been the sort of the backlog in higher risk notifications and in processing, evaluating and processing information of concern. When the day after we had our committee, we had our prioritisation discussion at board, and these were top right issues for us, and they are issues that have been proved to be quite stubbornly unresponsive to the interventions so far. So we continue to focus on those. We'll talk about them more at our next meeting, but we hope that the level of assurance that we can provide in relation to this, that the interventions against these are proving effective, will increase. Another area of concern for us, which we raised before, is in relation to the higher risk calls coming into the National Customer Service Centre, the safeguarding and mental health inbound calls. Pleased to say that since the meeting, the performance in that area is now ahead of the service standards, which is good to see. So thank you to our colleagues who've led that response. But it's an area where we feel that these are vital calls, and it's an area where we want to see we want to be able to do more in relation to that. So that will, but it's a specialist area, as Sean was telling us earlier, and it's hard to make easy, quick interventions in relation to that. So, but it's definitely something that we will pick up at the latest in the next round of business planning. We talked about internal and external sentiment, and we've heard a lot over the course of the day. It's come up a few times, the sentiment survey, but also the need to make sure that we focus on. There's lots of anecdotal information. We need to make sure that we're focused on what are the key measures that we're going to be tracking in relation to our external inputs in relation to sentiment, to make sure that the voices we're listening to are truly representative of everyone that we regulate. We did spend some time, again, another topic that's come up today, looking at our responses to some of the key public inquiries, and particularly some of the lessons learned so far. The responding to those has been, demanding and resource intensive, particularly when, as we've heard, they relate to reviews of activity which took place many years ago. Having said that, of course, it's absolutely essential that we respond fully, comprehensively, and transparently in relation to these, and provide all the support that is needed for these inquiries. So, the resource will need to continue to be deployed to deliver against that. In relation to the lessons learned, I think the key thing is we got some valuable insights from the work so far. I think the key thing, as we spent some time earlier today talking about, is to make sure that those insights are turned into action, and we really embed those learnings into improved ways of working. Not least it's another set of insights in relation to our record keeping. Our next meeting is early in January, second week of January, where we hope to sort of resume normal service a little in reverting to look at some of the areas that we've not looked at for a couple of meetings. In particular, where are we on progress with the significant number of recommendations that have been made to us over the years, which we have accepted, and where are we with the implementation of those? That's something we looked at a little while ago, and we need to look at again. Out of hours will definitely be on the list, which will be a relief to Belinda, who's been a constant champion of that. It will actually be Belinda's last meeting as a member of the committee, so I'd also like to add my personal thanks to her for her contribution to the committee. She's been a very valued committee member. Thank you.
Thanks, Mark. And it obviously leaves us with a gap on the board and knowledge of, on the non-executive side, Chris, of mental health. So we need to address that with the department. Last couple of things. We have some minutes of the last meeting that was circulated a while ago. I have no comments. Can we take those as approved? Yes. On the action log, just a couple of things I was going to pick up. So it starts on page 57 of the Diligent book. The first item on Ofsted, it was down for today, but that's the one we pulled. So I guess that's outstanding. So we'll pick that up next time and colour code it appropriately. Many of the others are for 25 delivery, so are on track. But item 6, the Charmian was, are we content that is now within the internal audit programme?
Yes, so basically, sorry, by way of update, we have spoken with, having spoken with Nadia and some of the team, we have also spoken with GIA and Julian actually prior to starting to look at potentially bringing an audit forward either into this year or as one of the first audits of next year, specifically looking at some of the data that was raised at the last board, so picking up on disciplinaries and grievances and ensuring that we are applying equal treatment to colleagues and how they are followed through, how they're raised, how they're dealt with. So we should have more information about that to the ARIC in 2 weeks' time.
Okay, good. Thanks very much. So we'll mark that as closed. Right. Any other business from anybody? Charmian.
Sorry. Just to say to colleagues around the table, it is Transgender Awareness Month, and the team have done a great job down the hall at putting together a virtual reality display and some videos and a gallery. I did the virtual reality at lunchtime, and it's well worth it. So they've agreed to stay around just in case anybody else has the time to do one or other. The VR took about 25 minutes, but it's quicker through the gallery. So if anyone can go, I'd recommend it.
Good, thank you. I not exactly any other business, but I just like to, I mean, James, you hand over, sure, the big sigh of relief on Sunday night, you hand over to Julian. But seriously, I know, in fact, for the whole executive team, it isn't just aimed at you, but we know the last few months have been quite difficult. I mean, this Julian, if you want to put it this way, he'll be the 4th chief executive in about 4 months. And I know that hasn't been easy for people. So I wanted to thank James for the way you, I couldn't even say volunteered, that's probably overstating it, but stood into the breach. But also to all of your colleagues, it wasn't just about you. I think as a collective group have rallied around in very difficult circumstances to keep the show on the road. And as we've said a couple of times recently, despite the fact things don't get done because there's a short of people, which we recognise and sympathetic to, there are so many areas in which we're actually getting better reporting and I think better insights now than we have previously. So I think we should recognise your contribution, but also, your colleagues and the way they rallied around. So thank you for that. I think that, it does close down the meeting. So we will close that. But as usual, we have a few questions. So the three of them, in fact, I'll take them in turn. The first one is down, I think I should deal with. Interesting question. It says, how is the performance of non-executive director members of the board appraised? So I'll include myself in that, although sometimes the documentation treats the chair separately. So the answer is that the Department of Health has specific requirements because both the chair and the NEDs are ministerially appointed. The appraisal of the non-executives, other than myself, is the responsibility, my responsibility of the chair. So on a formal basis, based upon observations of the boardroom, observation in committees, because I attend all committee meetings, even though I may not be a member of things, or virtually all committee members. And bearing in mind that what isn't visible to people watching, that many of the directors do an awful lot of work outside the boardroom, either in extra work in challenging or being supported from their extra experience. So I do get input from the executive team as well, both collectively how they think the NEDs are supporting them or otherwise, and how they are, the sort of additional information they provide. So I have a number of sources. It may not be quite 360-degree feedback, but it's very similar. So I am required to do appraisals, which I do annually. Of course, there are maybe interim discussions as well. If specific issues arise, but the formal bit, which was what I think you're asking about, is I do that, and I then have to submit all of that information to DHSC because it's all done in accordance with the format that they may require. I'm not going to go into the detail of it, but it's relatively standard. It includes setting of objectives, some of which I would do because they are specific to CQC, and some of which are standard objectives the department wishes to see all of us undertake, and that includes obvious things like use of public money. So for that's others. From my point of view, the department does this themselves, so they are responsible for gathering feedback from the organisation. They send feedback requests to people around this table, and such other people in the department, including ministers, as they think necessary. I couldn't tell you who they ask because although I get a summary of the feedback, it is all anonymous, so I don't know quite what the source is. I probably would say I think a high proportion of it comes from my fellow board members. And the department pull that together and they do an appraisal of me. And that is perfectly standard across all of the arm's length bodies. There's nothing different at CQC. So that is the answer to that question. Second one is, when a member of the public expresses a concern to the Newcastle office, how can CQC ensure the person is informed of the way in which this has been followed up? Good question. Chris, I'm going to ask you to answer that.
Thank you, Ian. Yeah, it's a very, very helpful question because at the moment when we receive information of concerns or notifications or cases, what we tend to do is we respond back to inform the person that will take action by forwarding it either to an inspector or to other colleagues. What we don't normally do then is at the end of that process going back to the person to say this is how we've dealt with that information of concern. So it's something we need to look at how best we can do that, considering some cases or some notifications take a very, very long time to get it resolved. Some might take months or even a year to get it resolved. So we need to work out a process of how do we go back to the person, because it might be someone raising concerns about their family member in hospital, for example, or someone raising their own experiences of care, for example. So I think we need to work out a process of how do we go back to people, considering some of those will take time to resolve.
Although it might be helpful if you give us a feel for the sheer volume of things. I mean, there are a range of seriousness, which, I mean, we were touching on how we handle this earlier for a different reason. But it is a massive volume, and I leave you to work out whether it's even practical to go back in every case. The other option is to whether we could give any themed reports. Now, I know that wouldn't necessarily give satisfaction who wanted to complain about an individual, for example, but it may be some themed level reporting could do. But in terms of volumes, just for the benefit of the person who asked the question, are you able to give us a feel for the numbers?
the number of people who either provide information through notifications or through give feedback on care?
Yeah, all of them.
I mean,
really.
probably
Yeah.
500,000. You know,
Yeah.
it's a big number. So it's not a work of moments. But I think your point. One of the things that we do try and do is to provide information to a lot of those people come from organisations and groups that represent people who use services that are our partners, and we do try and provide monthly briefings to them about how we're using that information to guide conversation. And we also talk about it thematically when we bring reports like the maternity report to the board.
Okay, thanks. And you've got the mic. The last question is for you anyway. How can members of the public participate in discussions about changes in CQC systems of working?
Really important question. People use services and the wider public at the heart of why we do what we do as an organisation. If you, we have, as I said before, we've got partnerships with about 2,000 organisations that work either nationally or regionally. But actually, on our website, you can, if you've got access to the web, you can just click on about us. How do you get involved? And there's an online community that has thousands of people who help us with our thinking around everything from what describes good in different settings to how we go about presenting results on the website. And we use colleagues and our colleagues use people use services in all of our thinking around how we present information to the public and how we gather it in the first instance. So you can go onto the website, click on about us and how to get involved. It's there alongside give feedback on care and access to other groups. It's a really good way of interacting. There are also, as I say, there are 2,000 groups nationally that we have relationships with. If you're a member of a local health watch, if you're a member of a Age UK, if you're a member of any other a group that provides support to people, we will probably be a link to you. But if you want the direct contact, come and join our community, participate in the conversations that we've got. There are thousands of them. I was at an event on Monday which brought together people who use services, our own colleagues and providers together to have a really interesting conversation about what good looks like in an inspection process.
Okay, thanks very much, Chris. That's the end of the question. Thank you for questions. We do try to answer them diligently. I think at that we can close down the recording. Thank you very much indeed for listening in, for those that are, and thank you to my colleagues for your participation today.